Hello all, very good morning. So in today's topic, I would like to discuss you regarding the concepts of primary healthcare. So coming to the concepts of primary healthcare here, so it was introduced in the year 1978. This was introduced after an international conference which was held at Alma-Ata in the USSR. Coming to the concepts here, if you see, there are different types of concepts which I am going to discuss in the coming slides. So mainly this primary healthcare concept, it was introduced in the year 1978. It was introduced after an international conference which is held at Alma-Ata in the USSR. So every country is involved here. They don't bother it is least developed, they don't bother whether it is highly developed. So every country, all the members who are involved in this conference, they have accepted that the primary healthcare is the vital part of healthcare system. So here if you see, so they have defined in the Alma-Ata conference, they have defined the primary healthcare is the essential healthcare made universally accessible to individuals and acceptable to them through their full participation and the cost of the community and a country can afford. Means everybody in a country, they should receive the healthcare and it should be acceptable by the persons who are receiving, and there should be full participation and there should be cost effective also. So this is the definition which was given in the Alma-Ata conference for the primary healthcare. So if you see the elements, so the elements which were involved here is like education on prevailing health problems and necessary methods to prevent and control them. So mainly they want to educate. They want to educate on the prevailing health problems which were already there in the community and how can we prevent them, how can we control them. They want to educate in those manner, and they want to promote the food supply and proper nutrition, and they are focusing on provision of adequate supply of safe water and basic sanitation, so that lot of communicable diseases, lot of waterborne diseases, they can be eradicated. And they are mainly focusing on maternal and child health care and family planning. They are focusing upon the immunization against the major diseases, and they are focusing upon the prevention and control of local endemic diseases and appropriate treatment for common diseases in insurance and provision of essential drugs. So these are all the main elements which were involved in the primary health care. So the basic health needs, the basic health support is provided through this primary health care. So if you see the principles and different concepts, they have discussed, means they are mainly having 5 main principles or concepts. So we are going to discuss in the coming slides. So here is the picture. So they are focusing on the equal distribution. So every country should participate and every individual in the country should have an equal distribution of their basic need, whether it is food supply, whether it is water supply, or whether it is a medical supply. Everybody should get equal distribution and community participation. So everybody should participate in the primary healthcare system, and they are mainly focusing, as we had discussed, on the elements that were involved in the concepts of primary healthcare. So they are mainly focusing upon the prevention of a disease and multi-sectorial coordination. So not only one sector, so public sector has to participate, government sector has to participate, and local bodies which were there, they are the most influencing persons on the community there. So those people also have to participate. So these two are also very important. Nextly, appropriate technology. So whatever they are using, whatever they are treating the patient, so they must use appropriate technology in order to obtain great yields. So what is this equality distribution? So all the people in the country, as we are discussing, everybody should, irrespective of their ability to pay, whether they are poor, whether they are rich, whether they are living in the rural area, whether they are living in the urban area, it should not matter. Everybody should get proper health services. So the majority, as we all know, the majority of the hospital, the majority of the treatment is being there in the urban areas. Mainly they are mainly situated in the city. So the rural people who are living in the rural and agency areas, these people are not having proper health facilities. So injustice to these type of people, those who are living in the rural areas, those who are living in the urban slums, and those who are living in the agency areas. So they must they also must have proper equal distribution in getting the services which were provided by the healthcare system. So they want to remove the social injustice, and the very simple concept is all the people who are living, whether irrespective of their age, irrespective of their richness, irrespective of their racism, everybody should get equal distribution. So the population of rural India, if you see, these are more vulnerable people for the diseases compared to the urban system, because the distribution of the healthcare services, the immunization programs or the national water supply sanitation program or proper health education programs, these were done in the urban areas compared to the rural areas. So because of this, the rural people who are living in the agency areas or who are living in the lower standards, these people are more affected with these diseases. So these people must be treated there, and their social injustice should be avoided. Nextly, community participation. So even though we are trying to give proper healthcare to those people, the community, if the community participation is lacking, so you cannot provide the care 100%. So in those times, the health personnel, the community health nurse, they must take the responsibility. The state government has to involve, the central government has to involve, the community has to involve, the families has to involve, and the individual itself has to involve, and they have to take care of their own health. Because as a human being, as a citizen of your country, it is your responsibility to take care of yourself. So whenever you are going and participating, so the healthcare benefits will be in a higher manner, and you will get proper treatment over there. So involvement of the community in all aspects, mainly in the planning aspect, in the implementation aspect, and evaluation aspect. So for example, if you see the best example for this community participation. So here in India, they have introduced two types of schemes there: village health guide scheme and diet training scheme. So here the people from their own community are taken, and they have been trained, so that the people from their own community is going and teaching them, they will listen more effectively when another community person is coming and teaching them. So this is some best example. And if you see in China, they have this 4 front strategy. So they have introduced the community participation in the name of barefoot doctors. Nextly, multi-sectorial coordination. The health sector alone cannot meet the demands of the primary health care of the country. So it has various elements. So what are all the elements? Community development, agriculture, animal husbandry, food, industry, education, housing. So all these things, when a person is having proper food supply, when there are proper industries, when there is proper education, when there is proper housing, so everything is relevant there, and they will help in the improvisation of the health of the person. And planning with the other sectors. So if you see if you see a hospital, so it has to maintain proper waste management. So at that time it can go and participate with the local panchayat or local municipality, so that there will be proper disposal of the waste material, and there will be no wastage of the resources that are available, and every sector, every person will have proper benefits over there. So this is the example. For example, if you see multi-sectoral approach here, mainly if you see the women care, mother care. So what are all the related activities? Marriage registration, ANC, PNC case and detection and family planning. So these are some examples for the multi-sectoral approach. So what are all the departments that were involved? If you see here, public health is involved, family welfare is involved, register of vital events, and community health nurse is involved. If you see here, mainly, what is the multi-sectorial approach? For example, mother is there. If they want to get marriage registration, they have to meet the community health nurse, and they have to go and meet the family welfare. And if you see for family planning, so if you see for family planning, they have to go and meet the community health nurses over there. Nextly, if you see the child care, so institutional delivery, birth registration, early breastfeeding, immunization, treatment of illness, and early child care. So all these things. So if you see what are all the departments involved here, so there will be public health, family welfare must be there, and pharmaceutical is involved, community health nurse is involved, pediatric hospitals are involved. So these are some examples for the multi-sectorial approach. For if you see the another example, prevention and control of activities. So what are all the departments means? So prevention and control of activities. So here if you see proper water supply and sanitation and urban development, rural development, agriculture, forest and animal husbandry and community health nurse. So these are all the, so if you see the communicable diseases, so they want to prevent them and they want to control them. So if they want to prevent communicable diseases, water supply, proper water supply should be there, proper sanitation should be there, proper urban development should be there, rural development should be there. So all these things will help to prevent the communicable diseases. So lastly, appropriate technology. So as I said, in the multi-sectoral approach, for example, if you want to deal large number of people, so large number of people can be treated using proper technology. So when the technology is coming involved in the work load will become very less, and the people who are working, they can work very freely and they can rely on the technology, and mistakes can be avoided and the human interference can be reduced whenever you are using the technology. So based on the community level, based on the affordability and based on the health issues and other risk factors, you have to use the technology. So these are the some examples. So nextly, focusing upon the prevention. So lastly, if you see, there is the fifth one is focusing on the prevention. Mainly prevention is the core strategy of the primary health care. So it is mainly going in three levels: primary, secondary and tertiary. So if you see the levels of prevention as we have discussed in the previous classes, primary means before the disease coming, secondary means after the disease has occurred, and tertiary means when the person is going into the end stage. So here if you see primarily, whenever you are getting immunized and whenever you are having proper protection, against specific health problems, so you can prevent the disease over there. So mainly the purpose of the primary prevention is to decrease the risk of exposure of the individual or a community to the disease. So before the person is getting exposed to the disease, the first itself we are giving the treatment, means we are immunizing the patient against the disease, we are immunizing the individual against disease, so that the disease is prevented from the community as well as from the person. And nextly, the primary prevention obviates the occurrence of health problem. Mainly it is reducing the occurrence of health problem. So what are all the measures means? It prevents the illness or the injuries that are occurring, and it is applied to the healthy population and precedes the disease or dysfunction. Means it is mainly given to the healthy population. So if you come to know if healthy population is being affected with a particular disease, for example, if you take the coronavirus, so whenever we came to know that this is a communicable disease and it can spread from one person to another person through droplet or through air, so government has kept the lockdown. So it is the primary prevention, means we are decreasing the exposure of the community to a particular disease, so the disease has been prevented. So coming to the examples of primary prevention activities. So if you see, what are all the primary prevention activities that are carried out by community health nurse, they are including encouraging the elderly people to install and use safety devices. So the people who are elderly aged, so these people, they have been taught regarding the safety measures, so such as handrails and steps. So whenever they are using the handrails or steps while they are walking on the steps, so they have these handrails, they give us the support and they prevent the falls, so that the injuries can be prevented. And if you come to the adults and the small children, mainly they are teaching the lifestyle behavior, so that they can adapt to the change and they can protect themselves from the particular diseases and their behavioral problems. And nextly, working through a local health department, mainly to control the preventable and communicable diseases, so that the disease rate in the community can be reduced. So coming to the examples of the control of communicable diseases, mainly we are focusing on rubella, poliomyelitis and varicella by providing the regular immunization programs. Nextly, secondary care. So here whenever a person is affected with the disease, they are mainly focusing on the early identification of the disease. So whenever they identify the disease early, the diagnosis can be made early and the treatment can be given early, and the complications with the disease can be reduced. So this is mainly coming into play whenever a person is affected with a particular disease, mainly to limit the infirmity or disability which is going to cause by the particular disease. So here mainly it is involving the efforts to detect and treat the health problems as early as possible. For example, if you take the cancer, so whenever there is a cervical cancer in a female patient, so we can go with the pap smears, and we can observe them in the pathological manner, and you can know the disease first itself, so that proper treatment can be given, and the earlier stage we can prevent the disease. And for hypertension and cholesterol, so regularly if you go for screening for this program, so all the high risk individuals, they can be identified, and we can give proper treatment to them, and we can prevent the heart attacks as well as strokes. And nextly, tertiary prevention. Here mainly it is focusing upon the restoration and the rehabilitation. So for example, if a person is having proper disease, if a person is having any kind of disease, and because of that particular disease, if any disability is occurring, so to overcome that disability, we are rehabilitating the patient. To overcome the particular problem, we are rehabilitating him. So in territorial prevention, mainly we are trying to minimize the disability and restore the previous function which was lost. For example, if you see treatment and rehabilitation of persons who after a stroke to reduce the impairment, and after post mastectomy, when a female has undergone a mastectomy, so immediately after the surgery they are mainly focusing upon the exercises so that the normal movement of the arm or the limb can be established. And nextly, early treatment and management of diabetes to reduce the healthcare problems. So these are the concepts which were involved in the primary healthcare. So these are all the 5 concepts. If you see, firstly, they are focusing upon the prevention, and they are focusing on appropriate technology. They are focusing on multi-sectorial coordination, community participation, and firstly they are focusing upon equal distribution. So these are the concepts of primary healthcare. So if you have any queries regarding the topic, you can drop them in the comment box, and if you like the content, please like, share and subscribe to the channel. Thank you so much. Thank you for watching.